The Delta variant of the virus is here in Idaho, and the precipitous increase in our daily case counts that Director Jepsen summarized is certainly additional evidence that the Delta variant is circulating in our communities. This variant is much more transmissible than previous variants of the virus, such as the Alpha variant that we detected circulating in Idaho earlier this year. And with previous virus lineages, what we observed is that a person who was infected with the virus went on to infect, on average, somewhere between 2 and 3 people. However, recent studies of outbreaks associated with people who have been infected with the Delta variant have indicated that when that person is infected, they will in turn infect somewhere between 5 and 9 people. One way to think of this is that the Delta variant is at least twice as contagious as the variants that have circulated recently in Idaho. So that's very concerning. The numbers can be somewhat abstract. There isn't a lot of difference between a person infecting 3 people versus 5 people, right? It's just the difference of 2 people. However, increased transmissibility poses an exponential threat. Even if the transmissibility went from, say, 3 people on average to just 4 people on average, over 10 generations of transmission, you would have 500,000 additional infections, which is a quarter of Idaho's population. So even though that average number of people infected that difference is small, when you start multiplying that, it can have significant impacts. The other concerning aspect of the Delta variant is related to what we refer to as the viral load of people who are infected. And scientists have looked at how much virus people have in their nose and throat when they're infected. And it appears that those who are infected with the Delta variant tend to have more virus, and that it is detectable much earlier after exposure compared to infections with viral lineages that came before. It's possible that the incubation period, which is that time between when a virus enters your body, starts to replicate, and then you're able to spread it to others, it's possible this incubation period is shorter with the Delta variant. So there's a combination of factors: a shorter incubation period, a higher viral load, and then the biological aspects of the variant that help it invade human cells. All of these factors together explain why this variant is so concerning and why recommendations have changed recently as new science has emerged about this variant. This includes the recommendation to wear masks indoors if you're in an area with substantial or high transmission. However, as Director Jepsen mentioned, there's good news, and that is that the currently authorized vaccines in the US do provide protection against this variant, and vaccination is one of the best ways to reduce the chance of additional viral mutations in the future. It's possible this variant may result in increased vaccine breakthrough infections, but recent investigations of outbreaks that do include vaccinated people tell us that those who are vaccinated are significantly less likely to have severe illness that requires hospitalization or leads to death.